Nicole, Dwayne said it would be more appropriate for you to come on rather than him or Juby because you're a clinician.
Yes.
Okay.
We're live. Okay.
Him or Juby because you're a clinician.
You guys hear me? Yeah. Okay. Just give me a second. I'm having a technical issue. Gordon, can you talk real quick? Somebody, Gina, say hello.
Yes, hello, can you hear me?
I did.
Yep. It's showing live on YouTube.
Excellent. So good evening, everybody. This is Chris Hankey, the superintendent of Garfield Heights City Schools. We're really pleased to have this really important town hall with a lot of our mental health agency providers that are going to talk to you about some of the things that are happening, and also some of the resources we have for our parents.
Yes, hello, can you hear me?
I did.
Yep. It's showing live on YouTube.
Excellent. So, hold on a second. I do apologize.
Good evening, everybody. This
Having
is
an issue.
Chris Sankey, the superintendent of Garfield Heights City Schools. We're really pleased to have this really important town hall with a lot of our mental health agency providers.
Apologies, folks. Can you still hear me?
Yeah.
Yeah.
Okay. I am doing all of the technical work tonight, so bear with us. Anyway, as I was saying, we do have a number of agencies with us, and what I'll do is I'll have everybody go around and introduce themselves based off the squares that I see on our YouTube. Lynn?
Hi, good evening, everybody. I'm Lynn Franks. I'm a clinical supervisor at Ohio Guidestone, one of the agency providers.
Gina?
Good evening, my name is Gina Wilson. I am the District Family and Community Engagement Coordinator.
Yolanda?
Good evening. I'm Yolanda Hamilton. I am the Diversity, Equity, and Inclusion Consultant with the Garfield Heights City School District.
Armando?
Hey everyone, my name is Armando Torres. I'm a school-based counselor for Applewood Centers.
Gordon?
Good evening, everyone. I'm Gordon Dupree, Director of Pupil Services for the Garfield Heights City School District.
Very good. And I believe it's Mr. Corbett Michael. Is that your first name, sir?
It's a good guess, Matt Corbett. I'm Matt Corbett from Beachbrook.
Apologies.
No problem. No worries. I'm a supervisor at Beachbrook.
Very good. And Ms. Smith Hicks, is that correct?
Yes, Nicole. I know my name is spelled just funny. Hi, I am Nicole. I am with Heart to Heart Health and Wellness. I'm a clinician there. I deal with adult and children.
Okay, as a means of introduction, thank you all. And I'd like to kind of pass it to Gina Wilson to talk a little bit about our relationship with these providers, and then we're going to kind of go through and see and ask some questions of them. Gina?
Yes, thank you, Mr. Hankey. So Garfield Heights City Schools work with a number of providers to provide services for our students and families. And we think it's very important to build relationships with these providers, to get to meet them and know who we have coming and working with our students, our families, and our community. In this town hall, we really wanted to focus on mental health and the importance on what it's like transitioning back to school from a pandemic, and how our providers are able to assist us with our students and our families, and how we can get those support. this evening we wanted to really focus on what are some of the trends that us as mental health providers have experienced with our students and families since the pandemic began. Let's start with Ms. Franks.
So I would say some of the trends that our providers are seeing, since the pandemic began would be increased depression, increased anxiety, increased stress, financial troubles due to maybe losing a job or decreased hours, housing issues potentially, and then students possibly having some social anxiety related to being back into big crowds again. And then just adjusting to this new way of life, this virtual life, mask wearing, and, all the guidelines that the students and families have to follow.
Great, thank you. I also want to add in, I do apologize. We want to make this as interactive as possible, and we want to be sure that our audience tonight has the opportunity to ask any questions. So if any of our viewers have any questions for any of the providers or anyone on this call, you can type it in on the chat. We're monitoring the YouTube chat, or you can send any questions to our text any questions to 216-777-2279, and we'll make sure that we get them addressed. Mr. Corbett, how about you? Do you have any comments regarding that first question?
You're muted, Mr.
You're,
Corbett.
you're on mute.
I turn it off so they don't hear all the background noise. We're noticing trends of the use of avoidance, a lot of avoidance with kids who are depressed or anxious. They'll try to avoid going to school or come in late, or just not log in if they're doing virtual. So a lot of depression, a lot of learned helplessness, and just a lot of struggles trying to change back to the schedule. Their circadian rhythms are messed up because they've been staying up late, playing a lot of video games. It seems like a lot of kids, and then they're not waking up till noon or 1 o'clock. So they're not really acclimated to the new schedule of getting up early and going to school.
Thank you. Armando, what are some of the challenges that you feel that you have assisted students and families with having to return back to school and to back to kind of sort of normal, back to being in school 5 days a week, going out into the community and society? What have you experienced any challenges with students and families? And if so, what are some of the challenges you experience, and how have you helped families get through them?
Yeah, so obviously there's been a lot of different types of challenges when it comes to that. As we slowly get back into a more normal learning environment. So I think a lot of the challenges, a lot of our kids had these routines that kind of got broken up. Mr. Corbett mentioned like the avoidance. So trying to plan and build that routine back up has been probably one of the more difficult challenges. A big thing I think that I've been focusing on is just having a plan, because when you implement a plan and a routine and you're getting back into that, it can decrease anxiety a lot and just make things a little bit more easier for the transition back into, what we deem as a normal environment.
Thank you. Nicole, you mentioned that you work with both students and families. And not only has this transition been difficult for our students, but myself personally working with families in this transition and returning back to school, and some of the concerns that they have, sometimes not even from the education standpoint. What are, from an adult standpoint, and families, what are some of the challenges and tools that you have equipped some of our families with?
I have a family that I'm working with now, a mom and 3 children. So not only are the children having a very big issue with getting back into the same routine that they once were, they didn't do very well with the online school. The mom also, as the parent, did not do very well It seemed that during the time that everybody just fell into a laziness because they wasn't able to go out, they wasn't able to be around other people, that the whole entire family fell into this. Now that school is back in, I have the mom having very high anxiety about her children going back into the school system. And even right now today, school just started back for them. They actually got in school late. The mom, she wasn't like, she thought all the way to after school started of, okay, where are my kids gonna go this year? And we had been discussing this the whole summer, and she can still continue to wait until after school started back. And she's already done had two teacher parent conferences over the children. So my biggest thing with the parent, her in particular, is I am trying to find a way, another way where I can get her more motivated into making sure the children get back on task as well as herself, because by her not being on task, she doesn't have her children on task. So we do daily scheduling. And even when I follow up with her the next day, she has not followed that schedule. So we have been working on daily scheduling for about a couple of weeks now. And I still ask for like input of what will make her, be able to, get back in the rhythm of things. But she still has a phobia about the pandemic. So it's really hard for her. It's truly hard for her. And it's also reflected on the kids as well.
Okay, I wanted to jump in because a couple of themes that are coming out of our conversation, particularly avoidance was mentioned. And I know oftentimes when individuals are undergoing like stress, not really even recognizing it as avoidance or being able to just put a name on it or identify it. So really, with everything that everyone has experienced from last year up into this year, realizing that we're still in the midst of a pandemic and everyone has been under stress. I don't think anyone could hide from the stress and the disruption of life that the pandemic has caused. But my question to you that I think would be helpful for families, like how outside of avoidance, like how do you identify like, hey, I'm really going through something? Because I think when you look at it, especially with the demographic of our district, the culture is just to kind of push through trauma, right? So oftentimes when we're going through trauma, not being able to put a name on it or to identify it as something traumatic or something that is stressful, that can really impede on whether or not a family or a student even feels the need to reach out about mental health services. So could you expound a little bit more on like outside of, in addition to avoidance, what are some other ways in which if a person is like, well, do I really need to reach out for help or do I really need to talk to someone? What are some other things that they should be attentive of or looking out for?
That's to me. Oh, okay. So the reason why I use this a particular person is because therapeutic services with her has been off and on. I think therapeutic services will be very good for her, but she is just not the type of person. And I would say that with anybody, that therapeutic services being able to reach out to have someone to be able to talk to. The reason why I use her is because she is probably my most difficult parent to get her back on track. Okay. So I have tried multiple things with her. I want her to reach out to her therapist, which has not been very well. I asked her to call me in the morning so we can see if I can get her started with her day. I try to get her more involved with making sure that the children are getting up and getting dressed and getting ready, because during the pandemic, all three of her kids have failed because in the middle of school year, they all just stopped going to school. They did not participate. They did not get online. And that was a very big issue that she had to overcome, but she used it as it wasn't a problem for her. It wasn't a problem that the kids did not finish. But as soon as school started back, she wanted to know why those children were pushed up a grade. And I try to utilize with her mindfulness skills and being open about how she feels about her children, and going back to school. And I guess with her, by her being the most difficult one, she sticks on to, it's not her, it's the kids, if that makes sense. So my biggest point with her is to get her started with reaching out more to her therapist, more to talk about what issues she's having as far as getting the kids back started, or at least getting her back started.
So sort of prompting her to take the initiative to reach out and to
Yes.
seek those therapeutic services. Thank you so much, Ms. Hicks. I wanted to ask Mr. Corbett, what are some things that you think that, you know, outside of the avoidance, like what should people be looking at to say, hey, maybe I need to reach out and to talk with someone, or maybe I do need some tools and support to help overcome some of the stress and challenges that I'm facing around mental health?
I think I tell this to my workers and clients alike, is I say, feelings are information. That's what they are. Your body's telling you something. So sometimes you need to sit and you need to listen to what your body's telling you, and just sit with it for a minute so that you can fully have the experience of what the emotion is. A lot of times in life, we use all these defense mechanisms to avoid the way we are feeling currently. We overeat. We'll do things like start relationships that are going to be fast and end quickly. Those kinds of things to try to cope with our feelings. But the feelings are telling you something, so listen to them. Okay. So I would say if your feelings are causing somatic complaints, like you find yourself getting headaches, stomach aches, you feel anxious all the time, then that's probably a sign that your body's telling you, I'm in a state of perpetual fight or flight, and that's not a good state. You don't want to be in a state of fight or flight all the time where you're constantly anxious or upset, because that's going to lead you to just express emotions without really being able to manage them. You'll just have you'll be quicker to anger and frustration. So you want to kind of, you look at your feelings a little bit differently. So I just give people a different perspective. Look at your feelings like information. Your body's telling you something. Are you listening?
So, Ms. Wilson, I'm sorry, Mr. Corbett, we lost sound, I believe, with you.
Can you hear me now?
Yes, okay.
I wanted to address a question that we had in our chat. We have someone that stated they've been suffering panic and anxiety since the pandemic. What can we do, or what can we offer advice to this individual in our chat? What can they do to help deal with that panic and anxiety, especially since the pandemic? We are still seeing that it's out there. Armando, do you have any tips for this person on the other line?
Yeah, I think definitely if it's been a noticeable panic and anxiety and something that's been interfering with your daily life and things that normally, you can accomplish, or even going to school or work or whatever the case may be, I think it's a perfect time to maybe seek out some services, or, seek out somebody to help or talk with. It's not an easy transition at all. I mentioned routine, and I think routine is something that really helps, whether that's even beginning something where you're going to bed at the same time, or you're waking up at the same time. Little changes like that can help, kind of ease some of the anxiety, and developing positive coping skills. I know for a fact, if you do come and seek services, I'm sure all these wonderful people have and will help you develop some of those coping skills, whether a lot of the things you're probably doing already, like listening to music, but being in that here and now and being able to ease your mind of that anxiety for whatever amount of time, I think will be beneficial.
Mr. Torres, Mrs. Wilson and I and a number of other school people have met in the past few days with a number of families that are really in crisis. We had a meeting today that was very sad. A mother told us that, well, her young man is in difficulty, her son. She said before she came to the meeting today, her sister had died. And we said we didn't know, we would have canceled the meeting. But anyway, she has cancer. Her son is helping her every day with her condition. She said, Ms. Wilson, at 2:00 in the morning, he's still doing his homework, I believe she said.
Mhm.
And Mr. Torres, what hope or help can you offer parents and young people who are in circumstances like that?
Yes. So I think a lot of that, especially with when we're dealing with somebody that passed away or dealing with high levels of care that we have to give, some sort of psychotherapy or grief counseling might be beneficial for them as well. And I think a lot of our services align with that and may be able to help. But if it's something to the point of, a real crisis for them, we always are there to help refer them to higher, more intense levels of care if needed.
Lynn, I wanted to ask you, can you describe, because again, like when you're dealing with stress, you have a lot going on, you're trying to manage, the students' needs versus the family needs. Like, can you sort of walk our families that are tuning in through like what should they expect at a typical session? Because I think that there's even anxiety around like, what does this look like? What is this really about? And I think that that's like a real concern or maybe a real fear based on just stigma. So can you, just to kind of alleviate those concerns for parents, just walk us through like what a typical, once they reach out to the school district or they are referred, like what are the steps and what does that look like?
Sure. So first we start with what we call a diagnostic evaluation, which is basically a lot of questions just to get to know you and to find out what's going on in your life, what you would like help with. And, once we find that out, we'll develop what we call a treatment plan. So it's just different goals that you would want to work on, that your child would want to work on to, alleviate the symptoms that they're experiencing. And it would also have on there ways to do that as well. So, goals, what you want to work towards, and then how you could achieve those goals. And then after those are completed, then the individual sessions would begin. We provide individual psychotherapy, which is, a student would sit down, with a counselor and talk about their feelings and where the feelings are stemming from. And then we also provide a service called TBS, Therapeutic Behavior Service. So that kind of focuses on coping skills. So, and that can be, that's an individual service as well. And both of those services could be provided either in the school or in the home or in the community.
Oh, I'm sorry, Ms. Hamilton. I want to address some of the conversations that are going on in the chat. We have some comments about bullying. Could you guys be an assistance for someone who may be experiencing the bullying, someone who may be the bully? And if so, when should parents start to reach out for services? I think there is a stigma, as Ms. Hamilton mentioned, around mental health and trying to deal with some of these situations on our own and pushing through. And I think it's very important as we continue to do these town halls to try to break that stigma and to understand that it's okay to reach out. When is it okay to reach out? And what should we look for? So I know that was a lot, but those are some of the concerns. Bullying, when should we reach out? And is it ever too late? Matt, if you want to start it, and please, Lynn and Armando and Nicole, please jump in if you have some more to add.
I would say address it immediately. Encourage your son or daughter to report it to the teachers as soon as possible in a confidential way. and to try to create a safe environment at home so that your child feels like they can come to you. You got to be, when you're parenting your child, you have to be careful not to be too authoritative yourself, or else you can be a bully. So you want to create an environment at home that's accepting of whatever the child tells you, because if you overreact to what the kid tells you, then they may not come to you again and not see you as someone they can feel safe with. So you want to create that safety at home. Come and tell me anything. It doesn't matter what you did. It's okay. Just let me know what happened. And if you can create that kind of atmosphere at home, it can really help to get them to disclose things that they might keep to themselves, you know, and not feel like talking about.
I think regarding bullying, there's probably a lot of that going on now. A lot of the kids have just lost a lot of social skills, I think, from being virtual for so long and not being around each other. You know, and possibly through the pandemic, there might have been some cyberbullying going on. So now they're back in person with each other and maybe confronting each other about it. So services would be important to address, you know, re-engaging in the appropriate social skills with each other. And I would say, like, you know, like Matt said, you know, address it right away. You know, all of our agencies are here available to you, you know, and we have to remember that it's so important to take care of our whole body. And part of our whole body is our brain and our emotions. You know, just as you go to the doctor once a year for an annual physical, you know, it's so important to take care of your mental health just as well, because that is a part of your whole being. And, you know, you have to make sure that you're taking care of yourself, because if you're not taking care of yourself, it's hard to take care of others. So, you know, making sure that all of your needs are met so that you can meet the needs of others. And one way, you know, to do that is to make sure that you're taking care of your mental health.
Yeah, thank you. I just wanted, before anyone else jumps in, the one person in the chat was asking, can you specifically list out like some resources? I'm thinking they're probably thinking of maybe like website or specific tools that they can, you know, seek out to help deal with maybe facilitating conversations about bullying or about mental health with their child.
Ms. Nichols, we can't hear you.
Can you hear me now? Oh, okay. I see that now that there is a lot of like mental health case management and therapy going into the schools now. And sometimes that can be a great resource to see if that is happening in the school that the child is in, for a great resource for the student or child, you know, to get assistance, for the parent to get assistance for the child. I also would like to say, to go off of what Matt said, that I also believe that getting in front of it head on, like right when it begins, is a very good thing, as well as making sure that you make the student child know that that they can tell you when certain things like that is going on, because I know some kids keep that stuff to themselves, and sometimes the parent have found out too late that it's been going on. So I really believe that if you make it, if a parent makes it a safe place for the child to be able to come and tell them something like that, like they are being bullied, you know, is a positive step towards some change.
We had another question come through the chat, and it was regarding insurance. We had a comment. Someone said, when I asked about what mental health resources school provides regarding anxiety, I was told my child didn't qualify because you only work with CareSource. Is someone able to speak about insurances, and if the insurance doesn't cover the service, what other avenues maybe families can take?
I can speak on that. So the predominant insurance the agencies do take is, you know, like the Medicaid insurances. However, some of our agencies do have people who are paneled to provide private insurance cases. So for example, Ohio Guidestone does have an outpatient counseling office in the Derby building, which is next to Ace Hardware. So we would have possibly some providers who are paneled to take private insurance. It just wouldn't be able to be in the school. But predominantly, it is the care source, but also, or any of the Medicaid insurances, but also we do offer consultation, which is about 5 to 6 sessions. And that's funding that we get from the Adams board.
I also would like to say that, I'm sorry, go ahead.
No, go ahead, Ms. Hicks. That's okay.
Yeah, I also would like to say, I know that, of course, we take Ohio Medicaid, and we also take, the HMOs, the Care Source, the Paramount, the United, Buckeye, Molina. And we also take, like, if say the parent has their own insurance through their job, and as long as that child, I know the child is part of the parent's medical most of the time, that if they also have that HMO, that Care Source or Ohio Medicaid, that also will help. You can also use the private insurance as well.
Ms. Wilson, if you don't mind me jumping in, one of the things I'd like to ask our providers is, how, as a school district, how can we help during the day-to-day interactions with children, as teachers, as administrators, and things of that nature to help? We have seen an increase in behaviors that could be considered inappropriate, some physical, that we hadn't had before. And we'd like to help, and we'd like to try to help foster, appropriate behaviors. Anybody can jump in, sorry. Mr. Torres, I'll call on somebody.
Yeah, so I think the number one thing I think everyone can do a little bit better with is just showing patience, because the fact of the matter is, we're getting back to, like I said before, this sense of normalcy. So after being away from, school for so long, I think we kind of all predicted that, these behaviors and things like that would increase. So I think an important part is just showing that patience, and then also linking them to the correct resources that they need. I think is very important. And another thing is consistency with, whether it's discipline or anything like that, because I think it's important for, especially when behaviors and things like that are going up, for some type of consistent consequences to be in place for just for learning.
Yeah, and especially at our elementary level, we're really concentrating on this PBIS system that we hope does have a level of consistency. But I appreciate your comments, Mr. Torres. Ms. Wilson.
Yes,
Panelists,
thank you.
can you address something that we think a number of parents are concerned with? How can we help families, especially young people, not overreact to the things that they see on social media? Can you give our parents and audiences some suggestions about that? Anybody?
I'm sorry, can you repeat that?
Sure. With the number of our young people being affected by social media comments,
Mm-hmm.
how can you all help families and young people deal with those negative things that they see and hear about that occur in social media?
I'll jump in. I think one of the things is you need to limit screen time for your kids.
Mm-hmm.
Don't give them more than 2 hours a day on the screens, because that's not healthy for them. I think the CDC recommended no more than 2 hours, no more than 25 grams of sugar, and no more than 2 hours on the devices. And you'll see a significant difference in your kids' behaviors, I think.
I think also, I think we hit a lot of the important points when we're talking about bullying, especially if those negative comments are coming from peers or others that would be considered cyberbullying. So I think getting the right help and right resources to kind of deal with that would also be something that they should look into.
I'll piggyback on that. Another thing is, help your kids get connected to other kids in person. Stop relying on the devices so much. Go out and meet people, even if you have to do it in a small group because you don't want to get exposed to COVID. Try to do social things on the weekends. Connect with other people, and those kids that are connected to their teachers, other kids, and their parents tend to thrive. So also I would say structure and consistency. Kids say they hate it and they fight it. However, they thrive in it.
Mm-hmm.
They do wonderful once they get put in it. So don't feel bad about putting discipline on your kids and being consistent with them, because they're going to whine and complain, but they will thrive. I tell you, that's what happens.
Yeah, just to piggyback off of Matt, and I agree with that. Limiting their being on a device. I think that the more that they're on there, the more they'll get into. Give them a time limit. Take it away during the school week and give it to them on the weekend. I mean, there's so many different things that you actually can do. And I also want to say that kids do love structure. I mean, they might say that they really do not, but they actually do thrive off of it. To have that structure, that's stability, is actually key. And if you can, if a parent can instill that in their child to get that, to do that structure, I mean, it will become very positive for them from, here on out in school, So I really do agree with that, Matt.
Yeah, it starts to become second nature for the kids.
Yeah.
Like I'll give you an example. I played soccer growing up 2 days a week for like my whole life, from like 8 years old to, I don't know, 14 into high school. And so now to work out twice a week is nothing. It's easy for me.
Yeah.
Like I don't even have to think about it. I just do it. And that's what the discipline that my parents gave me, it resulted in me having an easy time getting into workout schedules. So
yeah.
I think it's also important to, monitor their social media use and know what apps they're using. I'm guessing that, the children don't have a job to be able to pay for their own cell phone and service. So, just being mindful of that and, just knowing, like I said, what apps they're on, who they're chatting with, making sure who they're chatting with and talking to is safe, and that it's not, people other than their friends or other children that
I also would like to throw in that on a more personal note, I have one of my nieces. She actually then took the phone away from my nephew, but the big thing was like she pays the bill. She actually put a code on it, the phone, so there were certain things that he just could not do any longer. And that kind of worked out better. And if there was so happened, because it did happen once, where he actually changed an email address and cracked the code, she just took the phone away. But she took the steps. She took the steps to make sure that certain things he is not looking at, or he's not involved in when it comes to being on that phone and being in social media and using it for the wrong purpose. So I mean, it can work if you stick with it.
I would like to jump in and point out that the structure piece, the amount of our students that are in our co-curricular activities, we offer them officially grades 7 through 12. Is in almost nearly half the high school students, so they're seeking structure, right? And they're also, the good thing about us reopening is that we're able to provide those types of opportunities again, whereas before we were not able to, and we're working on some things to bring some more programming after school in the elementary school.
That's great. I wanted to touch on a point on self-care. We always hear, make sure that we are taking care of ourselves and keeping up with our self-care and having positive mental health. What does that mean? What does that look like? And how, with our busy lives, can we incorporate that every day to ensure that we are staying upbeat and really talk, taking care of ourselves in that self-care. Go ahead.
I'll chime in first. I would say, part of self-care is mental health self-care. So like mental flossing, go through your own thoughts, look at how you're feeling and reflect on it. Take some time to just sit and reflect. To do that kind of like, it's one of those things where you want to do it on a regular basis. If you find yourself being angry all the time, well, figure out why you're angry. If you feel resentments all the time, why am I feeling these resentments? And kind of take the time to reflect on it. Sometimes you need to sit and just reflect and do that that little bit of mental work to ask yourself a few questions on a regular basis, just to check in and see, well, is this okay, or is this getting out of control? And do I need to go ask one of my friends what they think, and then get some feedback from someone else other than yourself, and say, am I close to normal, or is this getting out of hand? So do like regular mental health flossing, kind of. And then, positive self-talk. Make sure you're telling yourself things that are good about yourself and that you're pumping yourself up, because nobody else will if you don't. So, make sure you say nice things to yourself and you're compassionate to yourself and you take care of yourself. And I have a worker she's great, Paula Parker, and she does great self-talk, and she teaches the kids the great self-talk. And one of the things she always tells herself is that she's a queen and she wears a crown, and she doesn't want her crown to be tilted, so she doesn't act crazy. She holds herself with composure and grace so that her crown stays upright. And I think that's the kind of thing that you want to do, that kind of mental health, the self-talk. It's really important. It seems simple, but it's really helpful and important.
And Matt, it's funny, in mentioning that, I just think about, my own self-care. Sometimes it's just as simple as on the drive to school, blasting the music and singing along crazy with my son, or doing something impromptu like, hey, after school, we're going to walk up to the store and just get some ice cream or something simple. It may be just kind of breaking up the monotony of the routine of just like work, home, school, because sometimes that cycle just can create stress. And so really I'm becoming more aware of like things that are a stress relief for me and in my family. Even like as adults, we're so programmed to stay on schedule and to keep managing like our households, but sometimes just getting on your kid's level, playing around with your kid, being silly with your kid, simple things that don't necessarily cost money, but create those connections and to kind of give you an escape from things. And I would also even offer to parents, one other thing is that, we try to limit our time watching the news, because what I realize is starting the day off and the first thing you hear on the morning news, like most of us are looking for the weather to try to see what we should wear for the day, as if we're really going to get a grip on that living in Cleveland, right? With all the seasons in one day, but just not, tuning into the most recent numbers or things like that, because that can create anxiety that kind of sets the tone for your day, where you're kind of thinking about that during the day. So just being mindful of those small little changes, just to kind of provide some self-preservation for yourself and to set the tone for you to go into your day with a positive mindset, a positive attitude, and just focusing on the good things that are happening. Because even in the midst of the pandemic, there are good things that are still happening in our lives. Our kids are growing, being virtual. Most of our families that were virtual last year, it's like your kids have grown in a year. And in some ways that maturity has accelerated because they were very independent in logging in and doing things that we might not have thought they were capable of doing prior to this. So just kind of focusing on the positive things that are happening in the midst of everything that's going on in the daily environment.
I also would suggest like doing little things each day, so they can build the structure to continually do it and do it a little bit more and more each day when you're talking about self-care. get in the habit of it, even so that, so they have to build it up, because I know some people, I know me for one, is really, really bad with self-care. I tried to get it in. I think my most self-care is sleep. But if you can just do a little bit of it a day, and just build up, to the point where it comes natural to you. It's very helpful.
I
I think
think
to piggyback on that, I'm sorry, Amanda, I cut you off.
you're good.
I was just gonna say the things that you do that are the most important are the things that you do every day because you're gonna do them the most.
Yeah.
So those little habits add up
Yeah.
to hours and days after the year's over. It makes a huge difference. You might think brushing your teeth 5 minutes every day is not a big deal, but at the end of the year, you won't have any cavities. That's huge because you won't have any pain in your mouth. You'll have healthy teeth. It has a compounding effect.
I also think to piggyback off of those comments a little bit too, I think one of the biggest things that we hear is that we can't find time to fit self-care into our schedule. So it's so important to set our own boundaries for ourselves. I think what we tend to do a lot is we find a free space in our day or on the weekend and we fill that up with something else that could, induce stress or whatever the case may be. So saying no every once in a while, setting that boundary, maybe we don't do that and we set some times for ourselves. Because if we're not helping ourselves, how can we help others?
And I would add to that, just making sure that you're having self-care as a priority, making sure that, you take that time and just make it a priority. And then as Matt was saying, it'll become a habit and just part of your everyday routine. Even if you just go for a 20-minute walk, you don't have to go walking for miles and for hours or, a long time, even if it's just a 20, 15-minute walk. And allowing yourself to take 5 minutes to yourself. If you're getting frustrated or stressed, just walk away from the situation just for 5 minutes and then come back.
In terms of self-care, I just want to add one more thing. I'm a big proponent of exercise. There are studies that show that exercise is just as effective at decreasing depression as medication. So our bodies are designed to move. So move, even if it's like Ms. Franks said, even if you're just walking is excellent exercise. I don't care what anybody says. Go for a walk. You'll feel much better. Anytime you work out and you stress the body, you're going to feel better afterwards. You might not like it at first. You might have to talk yourself into it and kind of, no, it'll be, I can do it. I'm going to do it. Even though you don't want to. Once you get started, it'll be easy to continue, and then you'll feel great when it's over.
Can someone on the panel address to help our parents with kids who for maybe a year and a half have been used to staying up all night playing video games and sleeping during a regular day and not getting their work done? Can any one of you tell parents how to get their kids on good sleep schedules so they can do their schoolwork and be alert in school?
Yes. So during the pandemic, and how everything changed for children, the school and how they get online and not having that, okay, you get up at 7, you get ready for school, you go to school, you get out at 2:30, 2:45. And then they have that, and then they do what they do at the end. And they didn't have that. I had a problem with my grandson who slept through school when he was online, like literally on the computer in class. He would fall asleep. And one thing I really did was I said, okay, so you need to come out your room. You need to sit at the kitchen table from this time to this time and stay up and be in school. And I think what really made a big difference is during the summertime was to get him back on schedule during the summertime, because when school was going on virtually, I did the stay up, in the kitchen, in the dining room for a certain amount of time, like you would be in if you was in school. So during summertime, you cannot sit and play your game all day long until 1, 2, 5 o'clock in the morning and then sleep all day because they get into that habit. So I am a very strict person when it comes to school and doing what you need to do. And the biggest thing that helped me was just to stop everything that was going on, everything that you allowed them to go ahead and do due to them being at home all the time. You have to actually just stop it, not go up into it or practice it. It's just completely just stop it. Take the game away. You can't play the game during Monday through Friday. You just can't. It's school time. You back in school. There's no need for you to be on a game. You should be doing homework. You should be playing football. You should be something, go to the library doing something. So that was one of my biggest things. It's like once school started and they was able to go back, everything that they was doing, everything that was going on at home during the pandemic, I just stopped it. So he was able, and don't get me wrong, it took a couple of days for him to get back into it, but it still worked because he had no outlet. He didn't have time to where that he can just get back on the game, even when school is out for a day, for a holiday. If it's during a weekday, you still cannot play your game. My grandson can only play his game on Saturdays. You can't even play the game on Sunday or even Friday after you get out of school. One day out of the week. So, but you have to stick with it. And if you stick with it, kids will get to the point where they like, okay, now they get their proper sleep. Now they wake up on time. Now they're not falling asleep in school. So I believe that is one thing that as a parent that you have to do is you have to stick with it and create that structure for your child.
Mrs. Wilson.
I'd like to piggyback on that. One small tip would be, as you're trying to get them to come back into a regular sleep cycle, is to get them out into the sunlight as soon as they wake up.
Mhm.
That sun exposure, it helps to reset the circadian rhythm of your body and get you used to waking up earlier. So that's just a little tip.
And Ms. Wilson, I would like to address some, and we're focused on mental health here, and I see some things in the chat about COVID. Would like to clear a couple things up. As a district, we have around 20 positive cases we've reported. Compared to surrounding districts, we are in very good shape. We haven't had any outbreaks in classrooms. We have 32 districts in this county. They're all open and everyone's attending in person. But my question, I guess, to the providers, and I know we've talked about this a bit, how can we help parents with some anxiety surrounding, the reopening of school in terms of, being, and it's obviously a very real thing, being scared in terms of the infection. Somebody would like to jump in. Nobody wants to jump in. How about?
I would say, just talk with your children about making sure they're following the CDC guidelines, using hand sanitizer, wearing their masks at school, doing their best to social distance, and, just having that conversation, with your child about, ways to be safe.
And I will say this, I know this is kind of off topic. We do know masking is working compared to districts that have it as an option. We have mandated masks, and we are looking at the possible extension of that. And we do know that we try to report as quickly as possible if there are any contacts of unmasked folks, unmasked students and staff. So our goal is to stay open and to be safe. And as Ms. Franks said, I mean, that's really the big thing, making sure you're wearing a mask properly. We'll have a mask for you if you don't have one, and practicing good hand sanitation. So, but I'll get off the COVID.
Thank you, Mr. Henke. So with about 6 months left, I want to say thank you to our providers and everyone on the call. But if we can go around to our providers online and just give one takeaway to our audience, students and families and communities watching, one takeaway that you want them to tuck away in their back pocket and just remember from tonight's town hall. And Lynn, we can start with you.
So I would say, I would like for you to take away, don't be afraid to get help. We're here for you. You know, all of our agencies have lots of different services that we could help you with. You know, and it's so important, as I mentioned earlier, to take care of your body as a whole, including your mind and your mental health. So, you know, just don't be afraid to get help, because we're here to help you.
Armando?
I love what Lynn said about, not being afraid to get help. I think, we hear all these stigmas about mental health, and we see them in a lot of different cultures, ethnicities, whatever the case may be. But we do see that it affects everyone from, the best athletes in the world to, our people that we look up to. So it's never too late, and we should all be practicing a lot of patience right now as we get back to normal. So just take your time with everybody. Nobody's, 100%. Everybody's a step behind. So let's just show some patience.
Ms. Smith Hicks?
I like what everybody just, the people who just spoke, what they just said, but I also I think my takeaway would be self-care and making sure that everybody is doing so. The families, the children, making sure that everyone is taking care of themselves so that they can get through the rest of this of what's going on, what we all are going through right now. And as far as the pandemic is concerned, the bullying and everything that's going on in the school districts and families and children having high anxieties of getting back to school. So I believe self-care will be one thing that I will actually take away from this, and would like for the families as well.
Mr. Corbett?
I guess I would say, be willing to be vulnerable, take a chance, be vulnerable, and talk to somebody if you're having an issue. I think you'll find if you just allow yourself to be vulnerable for a minute and you express to one of these agencies or workers your struggles, you'll get a lot of empathy, compassion, and you'll get a lot of support.
Thank you. And I think that's a great segue into my next comment in how to reach out and obtain these resources, or if you have questions on whether or not some of our providers would be helpful in any situation, feel free to reach out to myself. My name is Gina Wilson. I'm the Family Engagement Coordinator for the district. I can be reached via email, telephone, text. My email is gwilson@ghbulldogs.org. My office number is 216-475-8123. And I can be reached also by cell at 216-777-2279. I work with families individually. You can also reach out to your school and speak to your guidance counselors. You can discuss if you feel comfortable speaking to a principal or a guidance counselor and you want to know if this is something that may benefit you, please reach out and we'll make sure that referrals are put in. And I just want really everyone, students, families, community members, to know that we are here to support you. We are here to ensure that we have a smooth transition into school and we have a smooth school year. And to reach out, we can just have those conversations and we will be more than happy to help. In closing, Dr. Dupree.
I wanted to say two things, Ms. Wilson, and to our community. We work very closely with about 25 or 30 outside agencies, and so they're not all on here tonight. So we have a number of resources available to help pretty much anybody. The other thing is we have guidance counselors, social workers in the buildings, and other people who can also help, but they can't do it all. That's why we work sometimes with outside agencies. So we hope that all of you who view this broadcast realize that a lot of us work together in the school system as well as with people from the outside agencies.
Ms. Hamilton.
sorry about that. I just wanted to just say thank you for the information and that you provided to our families. I hope and encourage each and every one that's tuning in to follow up with Ms. Wilson to really learn more about the resources that are available to you. And also, if you have any other suggestions on topics that you would like to hear covered in the town hall forum, you can also email Ms. Wilson with those suggestions as well. And I'll turn it over to Mr. Hankey to close us out.
I'd like to thank everyone. I believe that this is one of the most important things we can do as the school year really starts to wind up, is to make sure that our families and our students are aware of resources for them. Don't be afraid to ask for help, please. We are here to help. Our agencies are here to help. On a broader note, as Ms. Hamilton mentioned, we are going to have these town halls once a month, at least. We found that they were a very good way to reach a broad audience. They're also recorded, and hopefully we will have timely topics each month. And if you do have suggestions, you can email or call me too. I'm at the board office at 216-475-8100. Just ask for Chris Hankey; they'll put you through. And I appreciate everyone, and I thank you. And with that, I'll say good night.